like to talk briefly about Vietnam and some of the reasons why I think we should promote industrial hygiene and safety in Vietnam. By the way, my name is Tuan Nguyen, and I work for State Compensation Insurance Fund as an industrial hygienist. And currently, I serve the ambassador to AIHA ambassador to Vietnam, and I also co-founder and board member of Vietnamese Industrial Hygiene Association, and I also member of WHWB. Here's Vietnam. It's a country that's about the size of California, and it has about 91 million people, and about 30% live in the big city, and the GPA per capita is about $2,000. So it's not very much. Okay, and here are some occupational injury cases in Vietnam for the past 10 years. As you can see, there's the trend of accidents going up, as well as the total number of cases. The fatality stay about the same. And right now, it's in 2014, it showed that about 230 people die. Here's another chart. From 2014 and to 2015, there's an increase of about 14% in terms of occupational accident, and the death claim also went up. If you look at this number, it looks a little low compared to other countries, and the reason because they're only about 7% reporting. In 2014, 2015, we have only about maybe between 7 and 7.3% of all the enterprises report occupational accident. So that means these same company kill the same amount of workers every year. And also the only 38% of fatal accidents were recorded due to poor coordination. So I don't know where the rest of the data went. Maybe it's delayed, maybe they just throw it away, or maybe it included in natural causes of death or traffic accident. So that we don't know yet. Here are some of the typical causes of accident. When I were in Vietnam, I went to some of the construction sites and take pictures. As you can see, these people, they work in a very high elevation without fall protection. Here another scene of another construction site. Very wet, muddy, no fall protection, uncapped rebar, and lack of PPE as well. There also, this is the site of a building that's going to come up. It will be about 4 or 5 stories high, and it's about maybe 11 feet wide. So the workspace is very narrow and it's very dangerous. They have to, I don't know how they're going to move the construction material in and out later on. Yeah. And over here you see that these window washer, and this person wear a slipper. So if he accidentally drop his slipper, it can cause a very bad accident for some pedestrian. This is the scene of a hotel that I stay at. When I heard the noise and I looked out the window and I saw a person washing the window. So I ran outside and took this picture, and I saw this is the tool that he used as for protection to lower himself down. So they use a lot of improvised safety equipment. Here is some ergonomic issue. This is in a ceramic factory. You can see they carry, bending, lifting. So they need a lot of correct instruction on how to do lifting and bending. This is the scene that I took many years ago, and this show that these people are grinding seashells to make them thin and smooth to put in lacquer painting. And look at the chair that they sat on. And the next scene is a home business. They refurbish lead acid battery. They probably had lead contamination, acid everywhere in their front porch. And this is another scene of the ceramic factory. These are propane tanks used for the kiln. And if there's a leak and this bike come in to park while they're still hot, it can cause an explosion easily. And last but not least is the traffic accident. People don't follow the rule, lack of enforcement, and some street don't even have red light, or intersection don't have red lights. Yeah. So there is a lot of demand in professional industrial hygiene, safety, and environmental health training in Vietnam. They need trained specialists as well as training opportunities, and they also need to develop train-the-trainer program so that these people can go out and train others. And the program itself needs to be standardized and have to meet international competency. Before we went over to Vietnam, I was able to get the support from AIHA, NIOEH, IOHA, as well as BOHS, OHTA program, to kind of work together to develop this program. AIHA provide promotion and support. NIOEH will help with research and training technical assistant. AIHA and VIHA is help develop to promote the formation of IH community in Vietnam, and BOHA, OHTA, and BOHS will help with the training material and certification. Then the main partner that we have in Vietnam right now is the National Institute of Occupational and Environmental Health. They will be the in-country trainers. So we need to train them so they can go out and do the training for the rest of the country. And last but not least is the very important component is WHWB. As you heard Mary Ann talk before, WHWB is an approved training provider for OHTA. It have a lot of industrial hygienists, certified safety professional, and professor in OHS that can volunteer to go to the developing country to help teach the program. And the goal is to help NIOEH staff to develop a good training program in Vietnam by using the international certificate program from OHTA. So briefly about NIOEH, they is the facility that train doctoral candidate in occupational health field and also school health. They responsible to develop refresher training, continuing education on occupational health, environmental health, and school health. They do collaborate with different universities to train graduate and postgraduate students. So I was lucky to be able to find the institute and develop the working relationship with them. And a few years ago, we were able to help them to sign MOU with AIHA and also the Memorandum of Collaboration with the NIOEH, CDC. Here the picture of the signing ceremony. Dr. John Howard and Dr. Margaret Kidd, and this is the director from NIOEH, Dr. Tuan, and behind here is his assistant, and she also the spouse of the ambassador to France, and now they are ambassador to Switzerland. So the OHTA training that we put together is the 5-day course. And we expect about 20 to 30 people, but we end up with 54. and the attendees are engineer, medical doctor, PhD researcher in occupational health safety field, and also in industrial clinic type. The OHTA program is a certificate program, and it has about 6 courses. There are 4 core that you have to take, and then you can have 2 or 3 electives. So you have to attend all the training, pass the exam, and then you have the certificate. And that certificate is recognized internationally at a competency in industrial hygiene. This is the picture of the front gate of the institute. This is us listen to Dr. Yuan on the first day to introduce everybody, and here the panel of our trainer. And this is Noel Casida. This me. This is Mary O'Reilly, and here the class. And the people are very attentive for all 5-day training, so I'm very, very touched with their enthusiasm and support. During the training, we also able to take people out to the site visit, and so they can collect some field data. And this is the picture of the closing ceremony. And after they completed the class, they get a completion certificate. And this is the picture of the trainer. And this is we were lucky enough to be able to invite Dr. Jeffrey Odell, the Health Affairs Attaché of the U.S. Embassy in Hanoi, to attend the closing ceremony. Yeah, and this is the group picture. So we need your support again, like everyone else said. The training, even though it's supported by the volunteer, but the courses that when people take, they need to take the exam, and the exam costs a lot compared to their salary in Vietnam, and also the OHTA support fee that we need to pay to support the program. And we also need to raise some fund for the volunteer for airfare and transportation costs to go over there. Yeah. So that's it. That's all I have. And thank you very much. If you have any questions, let me know.